Hi, welcome to Odontology and Tissues of the Tooth. The tooth consists of three parts: the crown, the root, and the pulp cavity. We're going to talk about each section. The crown is the portion of the tooth that is covered by enamel. Here's this picture here that comes along here, and if you were going to have an actual crown from a doctor, that's the part that they would cover. Now you're going to hear two other words, anatomic and clinical. The anatomic is the actual crown, and the clinical is if the doctor is doing an exam in your mouth, and so say it was a child and the tooth's not fully erupted, the part that they can see, that's the clinical. During the clinical exam, the clinical crown. Anatomic root is the actual root. It's covered with cementum, which we're going to talk about in a little bit, and from the CEJ junction, which we're going to have another slide here to talk about that. Here we are. So the cementum enamel junction is the CEJ. This picture is a good picture because it shows this patient has bone loss. And so you can actually see this junction. So here's the crown with the hard enamel on it, and then here is where it's going to join with the cementum, and that junction right there. The pulp is the inside of the tooth. Inside the crown, it's a pulp chamber, and down the roots are the pulp canals. So root canal, down the roots are the canals. The apex is the tip of the root. Apical foramen, you've heard foramen a lot. A foramen is an opening. And so on the very tip of this tooth here, you have a tiny opening, and that's where all the blood vessels and the nerve come. If a patient had maybe been in a car accident and a tooth got hit, or they got hit in the mouth playing ball or something, and the tooth seems to be fine, but later on, if that tooth rocked and rolled enough, all these fibers down here might have been detached, and that tooth would die because it's lost the blood vessels in the nerve of the tooth. So that a couple weeks, maybe a month or so go by, and that tooth is now discoloring, and that's why, and that tooth would end up with a root canal. There's four tissues of the tooth. You have your hard tissue, which is your enamel, and that happens to be the hardest in the whole body. Your dentin and your cementum, and then the soft tissue is, of course, your dental pulp. If you were assisting the doctor and you were going to do a root canal, sometimes they would pull this pulp out and it's almost all attached, and you can see that tissue, and it's soft and mushy compared to the hard enamel. Here we go. Enamel, the hardest tissue in the human body, covers the crown, protects the dentin. Dentin is harder than bone, but it's softer than enamel, and it's a lot softer than enamel. It's yellow to brownish in color, and as your teeth wear away, sometimes in older people, especially the lower anterior, because that enamel is thinner, from just chewing and through the years, that enamel has worn away, and you actually could see like a line of yellow, and that's actually the dentin coming through. Sometimes we have, which is very common, tissue and receding tissue, and so the tissue might come down here, so now you're showing dentin, and so somebody's, oh, my teeth are very sensitive, but I don't have a cavity and I don't know why. It's because dentin is being exposed and it's very sensitive. Sometimes they have to go on either fluoride to harden it, or something like Sensodyne. Cementum. So the tooth is now, how is it going to stay in the socket? The socket that's going to hold it in there, it's not part of the bone, it's not fused to the bone, or at least it shouldn't be. Sometimes that does happen, but it's just in there. And so what's holding it in there? So you have these little fibers. So think of cementum as like cement, and you have these fibers, these little tissues that kind of come off the tooth, and those fibers are holding that tooth in that socket. And you have your principal fibers, and then you have your Sharpie fibers, and those go to, so one part goes to the tooth, the other part goes to the bone that's holding it in. When a doctor is extracting a tooth, he'll rock and roll the tooth a little bit, and and that's to break these fibers. A tooth structure. Now a tooth is forming. How does this form? It forms a place for development for a tooth is called a lobe, and it has 4 parts. 3 parts make up the front part of the tooth. This is for an anterior, and only 1 part makes up the back, and because there's only one, that back is kind of caved in a little bit, and that's your cingulum. So here's your cingulum. So the back part of your anterior tooth, you can feel that there's like an indentation here, and then you have this cingulum that kind of comes out here. Mamelons. Mamelons are nature's way of allowing these lumps, these bumps on the bottom of the teeth, and that's just to help them erupt through the tissue. And as you eat, they just wear away. Now, and that's if you are in full occlusion. If you are not in occlusion and that tooth is high or something and it's just not getting that grinding of the daily chewing, then sometimes these mamelons have to be trimmed away. Antagonist. A tooth that opposes another is the antagonist of the other. Succedaneous tooth. So you have your baby teeth, your primary teeth, and then you're going to get your permanent teeth. Your permanent teeth will come down where your baby tooth is. So it's coming down second, it's coming down succedaneous. So you can see this x-ray here. This is a deciduous or primary tooth. Here's your permanent tooth up here, and that's going to take this place. I'm coming in second, I'm going to be your succedaneous. Molars and your primarily your molars, but also your bicuspids might have a fossa and pits, and this is a picture of a molar, and you have different fundamental grooves and fossas and pits. In your textbook you can see every single tooth and just what makes up that tooth. What are the different grooves and fossas and shapes of the tooth from the anterior bicuspid, cuspid all the way down. Thank you very much.